Well, hey, everybody, welcome back to the Military Wire. I'm Mike Schindler, and boy, do we have an amazing guest today. We've got Dr. Kris Peterson on the show today, and you guys are going to want to plug into this. If you've ever struggled with depression or PTS or things where you're just like, man, my brain feels scattered. I need to get back on track. How do I get clarity? So we're going to unpack that today, and I'm just going to give you a little brief about who Dr. Kris Peterson is. First of all, very excited to have him on the show. He's a board certified psychiatrist specializing in TMS. And if you guys are not familiar with that is transcranial magnetic stimulation. He'll talk more about that, but it's a cutting edge, non invasive treatment for depression, for their mental health disorders. And we're going to break that stuff down so you guys understand how can I take advantage of this if in fact I qualify for it, or if I don't, how do I? So we're going to unpack that a little bit today on this show. And honestly, Dr. Kris Peterson has also served in the military. I think that's really important. We'll have him share his story a little bit. So I'm going to stop yapping. Dr. Kris Peterson, welcome to the show.
Well, thank you so much for having me. It's something, what I do, I'm passionate about. I'm really fortunate to have a purpose which fits, what I want to be doing and being able to work with military veterans, people in my community. Literally, my job is to try to make people happy. And I
Mm.
do take kind of a military approach to that, which is looking to defeat depression, anxiety, PTSD in every individual that we see. So it is a little bit of a combat military related focus or approach. And I enjoy doing it every day.
Well, I love that. I mean, obviously, because we both served in the military, and I think it's important for people to understand kind of your background. Why don't you share just a little bit about your background?
I grew up in the Puget Sound area, went to a local high school, which is just off the military base, Joint Base Lewis McChord. And my buddies were all military. A good five, six of us ended up going to West Point, the military academy. And I was the kid with the longer hair, and they had the shorter hair. And I would go visit their parents, who were general officers and senior enlisted. And I'd be that kid with the longer hair, just enjoying everybody and everything going on. And somewhat as a joke, they put the application on my desk, and all six, seven of us went from my high school to West Point that year.
No
And
kidding.
this is
Wow.
not the direction you'd choose to go, pathway to become a doctor. And I
Yeah.
realized that, and I was interested in becoming a physician. But I felt called to go to West Point and still called to go into medicine. And I ended up going from West Point to USUHS, which is the Uniformed Services University of Health Science, the military medical school. And it's interesting is that I was indentured. I ended up owing 19 years back to the military.
Wow.
And I never regretted any of it. And I trained at Walter Reed Army Medical Center for my internship residency in adult psychiatry, and then did a fellowship in child and adolescent psychiatry. And it was an amazing educational experience. And from there, the military was demanding, but treated me well with different levels of responsibility. From Korea at the DMZ as a division psychiatrist.
Mm.
And then I ended up coming back to Madigan Army Medical Center at Fort Lewis, and was chief of a program working with children and adolescents, and deployed in 2003 to Iraq with 101st. Was attached to them with a combat stress control, a CSC unit, and was there. And after I returned from that deployment, and that's partly, I think, were the beginnings of a passion to treat mental health, PTS symptoms, depression in service members, seeing a lot and having experienced a lot during that rotation, that deployment, and then becoming chief of psychiatry at Madigan until 2012. So 8 years I was the chief of psychiatry at a major military medical center. Enjoyed that, but I was specifically tasked, find things that work to treat our soldiers and their families for
Mm.
depression, anxiety, and PTSD. Did research with the Seattle VA, Murray Raskin and Lane Peskin and Tammy Williams, some great people, on prazosin for the treatment of nightmares for military servicemen and women. And we found really nice results with that. We looked at EMDR, powerful
Mm.
intervention for PTSD. And then a friend of mine shared transcranial magnetic stimulation. He was doing it at Walter Reed, and I flew out there, met with him in the late 2009, 10. and some very interesting things coming out of that. And I deployed a second time, and I was getting too old for this stuff kind of thing. And as I
Yeah.
deployed that second time, I put in my papers, but with a passion to pursue this as a psychiatrist and entrepreneurially, as a business person, innovator, and started doing transcranial magnetic stim in 2012, 2013, and have not looked back. Right now with Touchstone TMS, where I work in the Puget Sound area, own, operate with a really good business partner, founder of the program, Zach Zimmerman. And we do transcranial magnetic stim, S-ketamine, which is an intranasal form of ketamine, if you will, and med management in 4 clinics in the Puget Sound area. And we have tremendous results. And that's what it's about. It's about seeing change. And we have roughly a 70% response rate to depression. And we've done internal studies looking at anxiety and PTSD. And I want to be clear, this is not FDA approved for anxiety or PTSD, but off label, it works for anxiety and PTSD. And our own internal review shows that. But a 70% response rate for depression, 30-40% remission rate for depression, and similar kinds of finding with when we follow with anxiety and PTSD symptoms.
Let's talk about this a little bit. Let's break this down a little bit on what number one, aside from, TMS, what it means, transcranial magnetic stimulation. Let's break that down a little bit first. But when we talk about depression or anxiety, I think, especially where the world's at today, right? I think there was a recent study that came out that said like 75% of those surveyed, 75% of the world is not really encouraged by what they're seeing. I know that the mental health issues have skyrocketed well over 60%, I believe are the numbers. So not only amongst our military and veteran families, but certainly the greater population. If you're dealing with depression or anxiety, how does TMS work? Like, what is it? Is it a pill I pop? Is it a chair I sit in? What is it exactly?
It's a great question. And I love what TMS is in that it's holistic and naturalistic. It's taking advantage of the brain's natural plasticity or ability to learn. What it is in the name. It's repetitive. There's a small R in front of TMS. Repetitive, transcranial, across the cranium, magnetic stimulation. And what we do is we put a magnet that's focused in a specific area of the brain, or you can have deep TMS, which we also do, which does basically a broader pulse into the cortex. And it takes a EMP, electromagnetic pulse, and the brain is an electrochemical organ. So when you perturb it, when you stimulate it, when you give a magnetic pulse, or when you learn, or when you do a number of things, neurons fire. What we are doing is forcing areas of the brain that are involved with depression, anxiety, and PTSD through this magnetic pulse to fire together repetitively, 900 to 1,000 pulses of it, several thousand pulses a visit. And when neurons fire together, they wire together. And you get actual dendritic and axonal growth and increased connectivity. And in reality, efficiency. It's felt to be, and I don't want to overemphasize this because studies are still another way, but a pro-cognitive intervention. It's being looked at for things like Parkinson's, Alzheimer's, autistic spectrum disorder. It's certainly not harmful in terms of learning or memory. That's been shown. So it's capitalizing on the areas that are known to be dysfunctional, not working well, and stimulating those to connect and become more efficient. And there's increased blood flow that's shown when you look at fMRI or PET scans, looking at these areas of function in the brain, which reflects increased connectivity or efficiency. EEGs often show a change in terms of internal communication being more synchronous or together. So I think that one way to look at depression, anxiety, and PTSD is brain inefficiency that might be from traumatic experiences, toxins, brain trauma, genetics, learning bad things, learning, that life is, things aren't safe. And what we're able to do is to begin a reparative process naturalistically through magnetic pulses. And again, it doesn't hurt. I think the biggest drawback is that logistically you have to commit to it for about a month and a half because you have to come in every day. It's not just one treatment and done. It's 30 to 40 visits, Monday through
Oh,
Friday.
no.
But with that, we entrain the brain to function better.
Is this like, I mean, it sounds, and it sounds almost like, like when the heart starts to stall and they put the paddles on the heart, right? Is this kind of what we're doing to the brain at the same time? Is it similar or no?
That's an interesting way to look at it. I think that we're manipulating hearts that way by giving a different pulse. We're
Yeah.
trying to reset it. And I would put it more in kind of a unifying mental health theory of wellness, that when you do therapy,
Yeah.
you're learning and you are
Yeah.
getting to these same areas that are not functioning well. And with cognitive behavioral therapy or exposure therapy or EMDR, you're causing your brain to fire in a certain way and you're learning. This is
Hmm.
a jump start to that. So I think it's more or
Okay.
less jump starting areas of the brain. And I don't think that anything stands best alone. I think this is a big piece of the puzzle, but I am pro bias towards therapy. I am
Yeah.
pro bias towards gratitude, positive thinking. You've heard me say this before. I use the acronym PRIME, and
Yeah.
those five: purpose, rest, intake, mindfulness, and exercise. And those are pro cognitive behavioral interventions that you do on your own. And that's going to go along with this, along with therapy, maybe a medication. You don't have to
Hmm.
be on a medication, but they have a role too.
Interesting. So, well, let's talk about that because I know, if military veterans oftentimes, the goal, not the goal, but oftentimes they're prescribed medication, right, for depression or anxiety. And so is that a requirement that you're on some sort of medication prior to getting TMS, or can I just go straight to TMS if I think, geez, I need this?
So there's no, from a provider standpoint and a patient standpoint, having to have been on any medications.
Hmm.
But insurance gets involved and they have some hurdles to jump over. And there's some contraindications to doing this too. But oftentimes, what you want to see is treatment resistant depression, which is defined differently by different people, but typically as a failure of two or more medications of an adequate duration and trial that are antidepressants
Hmm.
and or therapy.
Yeah.
Now, a lot of military, if command and if the hospital system says do this and you haven't been on a med, you don't have to go on it. Insurance kind of dictate this. This
Hmm.
works better than a med from my point of view at the
Yeah.
start.
Interesting.
But to get to it, oftentimes you have to jump through some hurdles. And some of those I'm very for, like therapy.
Yeah.
Um, and a medication may have a role, but you don't have to be on it. Sometimes they work synergistically with the TMS. Some things that promote learning or help with acuity help with TMS. So in some ways, you can look at stimulants or an antidepressant as being helpful, whereas pain medications,
Yeah.
things that are slowing the brain down, sleep medications, they are not contraindications, but they do work against us a little bit.
Interesting. Yeah, I mean, it would be great if somebody's dealing with depression that they could just come to you and just say, hey, you know what, I don't want to be on meds because maybe they have, maybe they don't like taking pills,
Right.
right? Um, are there options for that, or is it just, somebody's got to pay for this through insurance, or can they pay for it on their own? I mean, how does that work?
They can pay for it on their own. We're very veteran friendly and we want to get
Yeah.
people seen. And frequently we're able to work with commands or hospitals or VA to bring this to people. We are more successful than not in terms of using people's insurance.
Mhm.
And it is something where we strive and thrive towards having that treatment success. Again, purpose, mission, vision being first. And
Yeah.
if you're good at what you're doing, the business stays open because you're good at what you're doing and you're bringing something to veterans in a way that makes a difference. So I recommend people explore by calling, any TMS that's near them and seeing what is necessary or needed. And they may be surprised. The barrier has changed from when I started doing this 10, 13 years ago. Barriers were for medication trials.
Oh, wow.
Barriers were, yeah, it was a lot more frequent to say no than yes. Now, because over tried and true interventions, this being such a powerful one, you get people saying, yeah, this makes sense. Let's support this. And so you see this being more and more accessible. There's more people in the space. Majority are very good at what they're doing. I think it's really important to know that there's mental health providers available, that they're involved. And I have some suspect when there's not a presence, because though the treatment is very safe and very effective, depression is not safe, right?
Mm.
Anxiety, PTSD have things associated with them, to include suicidal thinking, where you
Yeah.
need someone manning the station, someone there to be able to work with people, sometimes hold the hope until hope is restored for that
Mm.
individual, if that makes sense.
Yeah. Well, yeah, 100%. It's so interesting. When I first learned about TMS, and you and I spoke about this, right? And it almost seemed, and I'll just be straight up because I'm sure some of the listeners will be thinking this is like, it almost seems like voodoo science, right? Like,
Yeah,
how is this like, because we've been so accustomed, hey, if you got a problem, take a pill. We're one of two countries that just promotes, pharma all the time. And so our
yeah.
brains are conditioned to, if you got a problem, take a pill, as opposed to there might be other alternative ways to do this. How do you break through the stigma? Because I think you and I both know that, as individuals who have served, we're like, well, I don't want to take somebody else's
Yeah.
spot. There's probably somebody worse than me. I don't want to be associated with going to mental health therapy because that could just wreck my career. Or if somebody finds out, and I think some of that's changed. Would you agree?
Yeah.
Like, I think we're more comfortable talking about mental health issues today, but
I think mental health stigma is eroded some, but not tremendously. There's still a lot of
yeah,
cultural, military as a culture unique, male female cultural kinds of, or gender kind of differences. Having to take a knee, warriors are not great at saying, look, I need to take a knee right now. And
yeah,
what I appeal to is the fact that there are a number of different things out there, but if you're not whole, if you're not operating well in terms of your resilience, then being able to pull that other person along or to do the mission is something that is maybe not sacrifice, but not on top performance. And if you're a war fighter and you're struggling with depression or PTSD, it doesn't necessarily get better with time. And so
mhm,
taking a knee, getting some help, in the attitude of I want to be at my best as a performer. You look at these elite
yeah,
athletes who've had head injury or physical injury. To look at them and say, well, they're not, we're not going to do physical therapy, occupational therapy, or work on our minds, work on our thought processes. That leads to less elite performance. That leads to diminishment. And really, on every level of life, there should be an attitude of I want to be my best. And if I'm at my
yeah,
best and I'm whole and I've got it together, I'm able to reach out and help other people and make a difference and find purpose. If I'm not, and people know that they're not, I think that's one way to break down stigma. And though I prescribe meds and
yeah,
think they're a tremendous tool, they're not all in all of everything. And so I do think we overemphasize that. And TMS, though it might sound magnets, I mean, you think
yeah,
about that and you can roll your eyes. This has a physiologic effect. It's been put up against sham placebo trials as well as any medication has. And of all the treatments that are out there, TMS is being shown to have a change in the outcome of depression the earlier you intervene with it. So
mm,
not a lot of interventions in medicine change outcomes. They cover it, they diminish it, they give the body a chance to heal itself. And this changes outcomes is what's being found. I just got back from a fellowship in TMS at Duke University, the second time I've taken it. And the data that's coming out, first time was about 5 years ago, went back. It's just evolving, and it's just an amazing area of exciting growth in mental health. Neuromodulation is the key word, and I think that's what causes people to feel better when you can neuromodulate.
mm.
Um,
It's so interesting because I guess if we really spend some time thinking about it, you know, we fuel off of energy, right? I mean, there's studies out there that say if you're around negative people, that affects your energy, right? If you're around
Absolutely.
positive people, it affects your energy. And yet, when we talk about, hey, let's use energy to stimulate a certain area of your brain, people are like, wait, time out. That seems a little weird. when in fact, no, that's probably the right approach to this. Have you, I mean, you're innovative. You talk about that. You're entrepreneurial. You've got this background. Are there new developments coming out with TMS? Are there things that are emerging? I mean, what are you seeing?
There are a lot of people have heard about the Saint protocol, which came out of Stanford, which is to give more numbers of pulses multiple times in a day, and they found a higher rate of remission of symptoms. It was fantastic rate of remission, and so there's new protocols, new areas of research, new depths to the pulses that we're able to do through different coil technology, different device technology. And it is something that I think will eventually get to a point, 5, 10 years, where you'll be able to do this at home. There'll be
Oh,
take home
wow.
like CPAP machines that you have
Mm,
now. I
yeah.
can foresee that happening. There's people working to develop that kind of thing. What we're doing locally in our clinics, we're doing some research. We're looking at EEGs, electroencephalography, before treatment, mid treatment, end of treatment, and a month after. And we're having some interesting findings that we're seeing. Our hypothesis being that you're going to see a normalization of EEG patterns in the brain. There's different groups that are looking at this kind of technology to more specifically tailor treatment. You can
Mm,
look at TMS as having kind of two different interventions. One is kind of a precise TMS. You're directing at different areas and you can move it around. It's a figure 8 coil. It almost looks like a Mickey Mouse ears.
mm,
And you're able to direct that to different areas, and different directions result in an improvement of mood, anxiety, even migraines, OCD. And so there's different ways you can do that in multiple different coils. And then there's a coil which is called an H coil, which is like a helmet that you put on. And it's a little bit more like a less precise, more deep, more kind of carpet bombing. You're
mm.
basically hitting everything. Both are really good. It's really important, I think, to be able to have, it's nice to have the dual capacity. You can do a lot of good with one type versus the other, but we're putting both together where we're at. We don't do them simultaneously, but for some people, the deep brain TMS makes more sense than the more directive and vice versa. And there's one's not better than the other. They're just different. And they give you in the right hands, different tools to be able to do different things. And
Yeah.
I love being able to develop those tools and those interventions. One of the things, and I know I'm talking a lot because I get excited about this stuff, but
No, this is
there's
good.
magnetic peripheral nerve treatment now. And this is for pain. This is for peripheral pain. It's using the same device generating a magnetic pulse, and you can put that on your shoulder. And that deep magnetic pulsation reduces the need for opiate use. It reduces pain. And so
Wow.
it's like a TENS unit on steroids. It gets your whole arm moving during the 15 minutes. And that's 3 treatments in a row. And then once a week afterwards for a number of weeks. But I just treated somebody a moment ago. And before I treated them, I treated my right hip and had nice pain relief in my right hip. It's one of those things that you can take yourself. And
Wow.
so it's fascinating. And to answer your question, tons of things, a lot of things happening in this field.
It's so cool to see the innovation taking place. And I think the thing that resonated really with me is anybody that's suffering from anxiety or depression or PTS and their desire is to be happy again. Like, define what that means. Like, if you don't want to struggle with these areas, this is certainly a viable option that should be explored. And I think that's really, really important. I mean, if people are hesitant towards this, because I mean, and we've addressed the stigma, we've addressed some of the the voodoo science, that
Yeah.
is not there. But if they're hesitant, what would you say to them to say, listen, just give this a shot? What is it?
I would emphasize the results: 70% response rate, 50% reduction in symptoms over
Yeah.
multiple domains: depression, anxiety, PTSD. 30-40% remission rate. And these are in the most, these are treatment resistant patients who have these kinds of results. I would say that it's a very low risk, non-invasive intervention. You do need to be screened for contraindications. And most of those contraindications are relative contraindications. I would put high up there reasons why we don't do this. If there's metal near the magnet, so if there's
Mm,
shrapnel in the brain, the eye, the face, we draw the line at the clavicular line. but really you can be closer than that, but you don't want to obviously heat something up or move something if it's in a sensitive area.
Mm.
If you're placing, this is a 1.2 to 2 Tesla magnet. You don't need to clear the room because the pulse only goes down 3-4 centimeters. So it's safe, but you need to screen for that. If there's a seizure disorder, the major risk for that is during treatment, a risk of seizure in 1 in 35,000 treatments. It's very low, it's very safe, but you need to be very careful with that. If someone has a seizure disorder, I typically will not do this.
Mm.
But again, it's a relative contraindication, risk benefit ratio kind of thing. And then I think it's important to be aware of any hardware that might be nearby that might be turned on or off with a magnet. So not absolutely contraindicated, but pacemakers,
Mm.
um, vagal nerve stimulators, deep brain stimulators, cochlear implants for hearing. These kinds of things are important to screen for, along with a number of others. But those are fairly rare. And if it's screened for, it is very safe. I've done
Mm.
this to myself also. It's aside from the peripheral nerve pain, for focus and attention, a number of things, also to experience it. And it's more common that you have a mild, tolerable headache.
Mm.
Not a lot, but some.
Yeah.
Some facial movement of the eye and the jaw, because there's a facial nerve that shows up there that you can directly stimulate. Some dizziness, lightheadedness, and pain at the site where we're doing this, mild, tolerable. We have less than the studies show less than 5% discontinuation rate. We have about a 1% discontinuation rate. 1 person to 100 says, I'm not going to do this because it's not tolerable. So
Oh,
it's
wow.
very tolerable,
Yeah.
very comfortable. You provide a nice environment. People enjoy coming and connecting too. That's the other piece. It's
Yeah,
15
I think,
minutes in duration, roughly 20 minutes in duration, typically.
okay. Yeah, that's, I think that, I was going to call this an alternative method, but it almost seems like this should be the method, but I mean, certainly not as for those who don't want to, pop pills, or maybe that's
Yeah.
necessary, but with treatment, I mean, this is so, I mean, first of all, thank you. Thank you for doing the work. Thank you for being, on the cutting edge of this. How do people find you? Like, if they want to learn more, where do they find you?
Yeah, Touchstone TMS is our organization. We're on the web at touchstonetms.com. I don't mind my phone number going out. This would be my direct line for people to ask me questions. I can give that to you, 253-344-0201. And then my staff is 253-393-9099. But all that would be on the website, touchstonetms.com. We're in Puget Sound, Puyallup, Lakewood, Gig Harbor, and Olympia. We really enjoy what we do. I couldn't be prouder of the team that's around me and how we have just good people dedicated to mission and vision in defeating depression, anxiety, and PTSD. We come back to that, we stick to that, and we enjoy our purpose.
Yeah, I love that. Well, and to our audience, I mean, as you guys know, at Operation Military Family, our job is really to help people achieve that new sense of mission, purpose, identity. And this is one of the ways, if you're dealing with roadblocks, if you're dealing with things that are just slowing your pace of trying to gain clarity, dealing with depression, anxiety, I truly believe that this is a methodology that you should explore. I will come right out and say I 100% endorse this. I've known you, Dr. Kris Peterson, for several years. I
Yeah.
don't know how long it's been. Every time I say it's been a couple years, somebody goes, "No, it's probably been a decade." So so explore it. Be sure you check out his organization, and Dr. Kris Peterson. Thank you for being on the show. Truly
Hey,
great.
thanks for having me, and appreciate you very much. Thank you.
You're welcome.